Hey everybody, let me ask you a question. You guys want to see more people? I ask that often when I speak. Everybody says yes. Do you want to learn how to communicate chiropractic better? And everybody says yes. I can tell you those two go hand in hand. If we want to serve more people with chiropractic care, we need to be able to communicate better. So I thought what I'd give you today is something that I use certainly in helping to get a patient or a practice member to understand what we do better. So I'll share a couple of situations with you. One, we call them step over issues. You know, those moments that often happen in your practice that you want to say something and you don't say anything. And then you regret it and you're thinking back later. And it's not that you didn't want to do anything, but you just didn't know what to say or how to say it or what was going to be effective. And I hear some people say, well, you don't want to make it about you and it's about them. And I get that, but I find more often than not, we don't know what to say. You don't know what to say that is going to be effective. So you say nothing. And that's 100% ineffective, though sometimes we forget it in the moment. So that being said, let's say that somebody comes to you and says, in your explanation, as you're explaining chiropractic, and they say to you, well, you know, I do a lot of stretching. I do a lot of stretching with my neck, and I do a lot of exercises. And, you know, I really work it every day. I get up and I work some things I saw on the internet, or maybe they came in and they're a React. I do everything you said, and I've been really good until now. My first answer is, well, I understand that, but one doesn't replace the other. Like, let me ask you something, Sean. Do you brush your teeth and floss, or do you only floss, or do you only brush? And they'll think for a minute. Sometimes they'll say, well, I do both. Well, that would be good, right? Why do you do both? And they'll say, well, because it's what's best for me. Right, exactly. So you wouldn't assume that if you brush, you don't have to floss. And you wouldn't assume that if you floss, you wouldn't have to brush, right? I mean, you know that each one is important, each one's significant, each one has a benefit for the health of your teeth, gums, and so forth, right? Does that make sense to you? Yeah. That tends to at least open the door then to the next stages of the conversation. So would you say it's important to stretch for your neck? Yes. But would you say that stretching replaces the adjustment? Would you say that stretching is going to push bones back into alignment, take pressure off the nerves, allow your body to work or communicate the way they're supposed to? No, yes. And depending on where you are at that point, we'll always have an X-ray or some study up that we had gotten from them. So I can show them really quickly. And I could say, well, listen, Bob or Sean, this is your X-ray. You've been stretching. Does that look good or bad? You know, now it's easy to get them because you've kind of laid some foundation because you've allowed one side of the brain to kind of talk a little bit to the other. Another one I'll use real quickly is in the discussion of, you know, is there something more that I can do? You ever get that question? You know, Doc, I hear what you're saying, but is there something more that I can do to get this to move faster, to get this to heal faster? You know, because I know I haven't taken care. I mean, I'm going to make this is kind of silly, but I haven't taken care of myself in 5 years, and you know, I got a golf tournament, and I heard it was good to go to. You know, sometimes you get that. Sometimes it might be from somebody who comes in the office who does what they need to do in order to take care of themselves, but for one reason or another, their body is not at an optimum function at that point. So I'll say, well, listen, Bob, you're doing it. Well, there's nothing more that I can do. Well, let me ask you a question. If I put more plaster on my cast, does that allow me to heal faster? And they'll say, well, no. So it's important that I put the plaster on, right, and put the arm in a position to where it can heal, right? Yes, but I can't put more plaster, right? I mean, that would be kind of foolish, right? Yeah. So essentially where we're at, what we're doing here is we're realigning the spine with an adjustment, right? Yes. And we're taking pressure off the what? The nerves, exactly. And that area of the body now is as healthy as it can be made. Is that correct as far as from the nerve standpoint? Yep. So now what's more important now? What's going to do the rest? Well, my body's going to heal, right? And it's going to take what? You know, if they need a little help, you just point your wrist. Well, it's going to take more time. Does that make sense? So right now, you create a healthy environment, and what's going to do the healing? My body, exactly, through your nerves, exactly. And now it just takes time. Does that make sense? Yeah, makes a lot of sense. So that'll help. You know, certainly a lot of times you'll listen to people, teachers, mentors, coaches like myself, some of there's a little bit of a gut feel that you have to have, and you have to learn to read people. Some of that's going to come through knowing what to say, and some of that's going to come through experience. You just got to do it. But one thing, and listen, I raised my hand. I've been guilty of doing it that way years past, the most ineffective way, and that is not saying anything. So when that moment hits, I will always tell you to say something, even if it comes out inarticulate, even if it comes out poorly. You're much better off saying something, because I can promise you this: if you're coming from the right place, if you're coming from heart, if you're coming from love, if you're coming from truly caring about their interest, and understand that whatever you do is certainly has their interest much further ahead of your own. If that's where you're coming from, you've never done anything wrong. You'll never fail in that situation. Because let me tell you something, you can do everything right. You can do everything right. You can say everything perfect. You can read them as well as you possibly can read them. You can have exactly the right words to say in the perfect moment, and they still aren't ready to hear the message. Do you know what I mean? So it isn't necessarily doing everything that's right that's going to make it all go. But the worst thing you can do, and I'm not trying to beat anybody up, the worst thing you can do is to do nothing. That's the worst thing you can do. So at least say something, and hopefully just that little couple of phrases I gave you will give you something maybe to say if you're out in public, or if you're in the office, or you're at the adjusting table, and somebody kind of has a question or concern about how to handle that certain situation, how to handle that change and adjustment, and so forth. And there's a million other ones that we work on. I would love to teach you more and certainly share more time with you. We are having an event here coming up very soon. Visit our website, which is chiropassionconsulting.com, chiropassionconsulting.com. And we also offer trainings right in our office. So we've been doing that for many years now. As a client of our program, you can actually come right in the office and train with us for 2 days. And we show you how we do everything exactly, as well as how we handle patients, how we handle these certainly objections or concerns or questions. Because in the end, your ability to communicate what it is we do is critical in not only getting them to understand what we do, but to adopt it as part of their lifestyle, to value it, to take action, to follow through with your recommendations, which is in their best interest. But we need to be really good. We need to be highly effective speakers, communicators in that, because the world doesn't know what we do. Guys, thanks for giving me a few minutes of your day. Have a wonderful weekend, and I'll talk to you guys soon. Thanks so much. Bye-bye.